cancer. It's a word we all know, and honestly, a word we all fear. But what is it, really? What's happening on a microscopic level? Well, in this explainer, we're going to break it all down. We're going to start with the tiny cells that make us who we are, to really get a handle on how they can go wrong, and what we can do about it. So let's start with a scenario that, well, nobody wants to imagine. You find a lump, or maybe a mole looks different, or you have a symptom that just won't go away. That feeling, that's where this whole journey begins. So let's walk through that journey together and try to understand what happens next. All right, here's our game plan. First, we'll look at the difference between benign and malignant cells, then how cancer grows and spreads. After that, we'll dive into how we find it, how we form a battle plan to fight it, and finally, we'll talk about the human side of it all, the treatment and the care. Let's get into it. Okay, first things first, we have to get this straight. Not all tumors are the same, not even close. This is the absolute starting point, what I like to call a tale of two tissues. See, it all starts with cells, but the way those cells behave, well, that's what decides if a growth is just a harmless bump or something much, much more serious. And this table right here, it lays out the differences perfectly. Think of benign cells like good neighbors. They stick together, they stay inside their own well-defined, fenced-in yard. They grow pretty slowly, and they respect boundaries. Malignant cells, they're the total opposite. They are absolute rebels. They don't stick together, they have no defined borders, and they just invade the surrounding tissue. They grow fast and chaotically. But the biggest difference, the one that really defines cancer, is that last one. They metastasize. They spread. And that ability to spread, that's what we need to tackle next. Because this is what makes cancer so incredibly dangerous. It's not just about a tumor growing in one place. It's about a hostile takeover of the entire body. And the name for that takeover is metastasis. This is the process that makes cancer so formidable. Essentially, these malignant cells decide to go on a road trip. They break off from home base, hop onto the body's superhighways, the bloodstream or the lymph system, and set up new tumors in completely different places, like the lungs or the liver or the brain. And just like that, a local problem becomes a full-body disease. And this is why time is absolutely everything. This number is just staggering. In about half of all cancer cases, the disease has already metastasized by the time it's even diagnosed. And what that means is, for half of all patients, the fight isn't in just one location. It's body-wide. And that changes the entire game, which is why finding it early is so critical. So that brings us to the next big question. If catching it early is the #1 goal, how do we actually go about finding it? Well, it all starts with a kind of search party, understanding who's most at risk and knowing what signs to look out for. So doctors usually start by looking at risk factors. Now, some of these are things we just can't change, right? Like our age, our sex, our ethnicity. But a lot of the really big ones are tied to our lifestyle. Things like using tobacco, alcohol, our diet, and even exposure to certain viruses. Knowing this stuff helps build a picture of someone's individual risk. And these are the key warning signs you can actually look for yourself. Now, finding one of these doesn't automatically mean you have cancer, but they are crucial signals from your body telling you to get checked out. We're talking about stuff like a lump you've never felt before, a mole that suddenly changes color, a cough that just won't go away, or any kind of unexplained bleeding. Being aware of your own body is your first line of defense. Okay, so once a concern pops up, there's a pretty logical process that gets started. It begins with assessing those risks and symptoms we just talked about. From there, it usually moves to screenings and imaging tests, then maybe blood tests that look for specific markers. And finally, the step that gives a definitive answer, a biopsy, where a tiny piece of tissue is actually looked at under a microscope. Let's dig into those blood tests for a second, the serum markers. Think of them like little clues floating around in your bloodstream. For example, a high PSA level might point to a problem with the prostate, or a high CEA level could be a red flag for certain colon cancers. Now, these tests alone aren't a diagnosis, but they are a super important piece of the puzzle. So let's say a diagnosis is confirmed. The enemy has been identified. Now what? Well, now it's time to form a battle plan. And believe me, modern cancer treatment is almost never just one single thing. It's a coordinated, multi-pronged attack. And these are the main pillars of that attack plan. You've got surgery to physically remove tumors, chemotherapy to attack cells all over the body, radiation to target them with high-energy beams, and then you've got newer approaches like immunotherapy, which actually uses your own immune system to fight. And holding it all together is nutritional management to keep the body strong enough for the fight. And even within just one of those pillars, like surgery, the mission can be totally different. Sometimes surgery is preventative, removing tissue that's at high risk. The dream goal, of course, is curative, getting the whole tumor out. But sometimes the goal is palliative, not to cure, but to make the person more comfortable by relieving pain or pressure from a tumor. But surgery can't always get every last cell, especially if they've started to spread. And that's where something like chemotherapy comes in. Its whole mission is to go after cancer's biggest superpower, its ability to multiply like crazy. Chemo drugs circulate through the entire body to disrupt that process, to stop those cells from copying themselves. It's a full frontal assault designed to halt the invasion. But these incredibly powerful treatments, they don't just happen in a lab. They happen to a person. And this is where we have to shift our focus from the disease to the individual and really navigate the tough reality of treatment and all its side effects. Yeah, every powerful therapy comes with a trade-off. It's a double-edged sword. For example, hormonal therapies might cause things like hot flashes and nausea. Some types of chemo, like anti-tumor antibiotics, can have really serious risks, like damaging the heart. A huge part of the overall care plan is just managing these side effects. And this is where the human element is so incredibly important, because care is so much more than just medicine. It's the hands-on clinical work you see here, checking vitals, listening to lung sounds to catch problems early. But it's also about encouraging recovery, teaching breathing techniques, and just as importantly, being that source of emotional support. It's about treating the whole person, not just the disease. And this quote, wow, it really says it all. The job of the healthcare team is to be an advocate, a protector, and a supporter. It's about making sure the patient's voice is heard, their rights are protected, and that they are at the center of every single decision that gets made. Okay, so we've looked at the cells, how cancer spreads, how we find it, and all the complex ways we fight it. After all of that, what is the single most powerful weapon we have? Is it the sharpest surgeon's knife, the newest chemo drug, the most advanced machine? It's this: early detection. Finding cancer before it gets a chance to spread changes everything. It gives you more treatment options, and it massively improves the chances of a good outcome. So in the end, knowledge, awareness, and acting on that awareness, that is our greatest strength in this fight.